Hey, good afternoon, everyone. Welcome to part two of spokesperson training and practice sessions. This is Cheryl Welbeck. I'm the project manager for Directors of Health Promotion and Education. Today's practice session and the webinar presented on Monday are part of the National Implementation and Dissemination for Chronic Disease Prevention Initiative. All lines currently are on mute. And we have with us today Courtney Thompson and Lisa Tensuan, both from FHI 360. Lisa is the associate director, and she's an experienced project director in social marketing and communications. She's got 14 years of experience in health communications campaigns and projects. And Courtney Thompson is the marketing and communications officer in social marketing and communications at FHI 360, with 6 years of experience working in behavior change and health communications. Courtney and Lisa presented Monday's webinar on spokesperson training. Just to go over a couple of housekeeping items, you'll notice to your right is the control panel. There you have the option to use the chat box or the question box if you have questions during today's practice session. The practice session is actually designed to give people an opportunity to practice some of the tips and techniques that were discussed on Monday's webinar. So if you have a question or have issues with audio or anything else, please feel free to shoot me a message in the question or the chat box. And I'll turn things over to Lisa and Courtney to get started for today. Lisa and Courtney, welcome.
Yeah. Thank you, Cheryl. So like Cheryl mentioned, this is Courtney, and Lisa is on, my colleague Lisa Tensuan is on the line as well. And like Cheryl mentioned, on Monday we talked a little bit about audiences, and then we talked about tips and techniques for being an effective spokesperson, and then we had a fair amount of handouts, or a couple of handouts that you can actually download now as well. If you'd like to take a look at them, you're more than welcome to. They're in the handouts pod. But we wanted to give this opportunity to really go in depth with a few people who had signed up for the spokesperson training, to go in depth and practice that spokesperson training that they learned. So we had our sign-up sheet, and it looks like, let me just double check. I think Katie Maloney, I think you might be first up. So Cheryl, are you able to unmute Katie Maloney's line?
Yes, I am. So let me go ahead and do that now.
And for others on the call, please feel free I know a lot of you are joining just kind of to listen in on these practices, but if you have questions, or if we happen to have time at the end of our kind of half-hour blocks and you'd like to ask some questions or do a little practice yourself, please feel free to chat in the chat function or send Cheryl a message. We certainly want to be able to practice with as many people as we can today.
Okay. Katie, your line is unmuted.
Hello.
Hi, Katie. How are you?
Good. How are you?
Good. Good. So, Katie, could you tell us who you're with? I think you see it. Yeah. Go ahead.
Yep. I'm with District Health Department number 10 in Oceana County, Michigan, and our department is part of the National WIC Association sub-recipient for the grant, for the Community Partnerships for Healthy Mothers and Children grant.
Okay, wonderful.
Excellent.
Great. So, and Lisa, please feel free to jump in
Sure.
whenever you want to. But Katie, I was going to say what I think we could do is, had you gotten a chance to look over the identifying your audiences and the message framework worksheets?
Yes.
Okay, great. So I thought we could start talk a little bit about what kind of spokesperson opportunity you would want to practice. Is it going to be media? Is it a presentation? Is it more of an elevator pitch kind of thing? And then talk about your audiences. And then we can really, if you have any questions around your message framework, we can work through those. But if not, we can just do a practice round and go through and then talk about that.
Okay. Well, the different messages that we're hoping as far as being a spokesperson for would include interviews with local newspapers, and possibly a community presentation to some stakeholders and other organizations in the community. We're a pretty rural community, so we don't really have like a television network. We do have a local radio station that's based about 25 miles away, so a radio interview would also be another possibility for us.
Okay.
And go ahead.
No, and Katie, I guess in doing those, the newspaper, radio, possible presentation, are you the one that would be doing that on behalf of this, your sub-recipient award from National WIC Association?
I think that it would either be myself or our project coordinator, who is actually one of the WIC coordinators for a couple of counties in our district. She is more directly involved as the kind of organizer for the project.
Okay, perfect. That's helpful.
And our audience is, since it's through the National WIC Association, primarily mothers, children, and infants in Oceana County, but we have the hopes of impacting the greater community as a whole and primarily families in Oceana County.
Okay. And it's Oceana?
Yes.
Okay. Oceana County. Okay. So it's the mothers, infants, and children, and then you're really trying to reach out to families. So when you think about families, are you thinking, is it the caregivers, or is it people with children of a certain age, like 0 to 5, 0 to older?
Right. Yep. Primarily we're looking at parents and families of younger children that fall into the category of being able to receive WIC benefits. So 0 to 5 years old is the primary age group that we're kind of addressing through the grant.
Okay. Okay, great. So Katie, would you like to practice this as an interview with a local newspaper or a presentation? What do you think would be most helpful?
I think the interview would probably be beneficial for me. I have not really done a personal interview yet, so I'd like to get a little bit more comfortable with that.
Okay. Okay, great. So I think with an interview, if you have the message framework in front of you, you can use that as kind of like your notes and your guide throughout. And what we'll do is, like as we do this practice, we will kind of, our questions will at first kind of follow that, and then we might throw in a couple, not hard balls. We certainly don't want to do that. But we'll throw in a couple there where you can start practicing some of the techniques that we talked about staying on message and bringing it back to your message. That's kind of the practice that we would want to do.
Okay.
I think just for everybody else who's on the line too, some of the things that we talked about staying on message, and then we also gave some really, I just want to go over like a couple kind of reminders before we get started of the things we talked about. So when it comes to, especially with like a media interview where your audience might be a little bit more general, think about the way you're talking about your program, and if there are, we want to keep it as plain language as possible. So if there's a lot of acronyms in there, really explaining what those are, or if there's maybe some technical jargon, instead of saying the technical way, you can use that word, but then say, and what I mean by that is, and explain it so it makes it easier for everybody else to understand.
Okay.
So that's kind of one of the bigger ones. Lisa, anything else to add there?
I guess some of the things we didn't go really that deeply into are, when you're thinking about your message, and you are really lucky, Katie, because I saw the wonderful messages that Elizabeth Epps had sent out to everyone. So you've got a good starting point for those key messages that National WIC Association wants you to be putting out. But I would just say, as you're thinking about, your messages and speaking, you know, avoid focusing only on the problem. And this is kind of in the message framework, but thinking about what those effective solutions are, what actual steps you're asking your target audience, in this case, you know, the parents and families of younger children, what you're asking them to do and to what steps to take. So that's one piece that I don't know might not have come through really that clearly in our presentation, but I wanted to just mention that as well. So I think that's it, Courtney.
Okay. All right, great. All right, Katie, any questions for us?
Not at the moment, I don't think.
Okay. You ready for practice?
Sure, yeah.
Okay. Lisa, do you want me to ask questions first?
Go for it.
Okay. All right. Okay, we'll see if I can, I'll try to put on my best reporter voice. We'll try that. Okay, so Katie, thank you for being here today. We're glad you're able to join us.
Thank you for having me.
Yeah, so why don't you tell us a little bit about the work that you're doing right now?
Sure. So the work that I'm doing right now in Oceana County is actually through a grant funded in part by the National WIC Association. And what our primary focus is, we want to impact the nutrition environment of the community, so the foods that are available to families in Oceana County, as well as the clinical services that are available, so the physician offices and other resources such as that to take care of health needs. And what we'd like to do with that is we want to kind of leverage the resources that are available. Our county is a major hub for agriculture. It's a very rural economy with a lot of resources as far as different crops throughout the year and different agricultural resources. And what we like to do is want to leverage those resources and really kind of work with the existing services that are available to make healthy foods more accessible to the community, as well as clinical services.
So, Katie, why is this a problem in our community? Why do we have to make these healthy foods more available?
Well, we have a really great need for increasing access to healthy foods in Oceana County because we do have some prevalence of some health issues such as obesity and also rates of diabetes. A lot of adults living in our county have high cholesterol and are either overweight or obese, and they also have high blood pressure and other heart disease issues. So based on some of the research we've been able to do and other similar projects, we have a great understanding that if we can increase access to healthy foods and to these resources that are available, we might have the ability to reduce the impact of some of these health issues and help people really take control of their health.
All right, excellent. And so is this a new approach that you're taking to solve the problem, or is something like this, have we done this before?
This is a new project that we're working on. However, there are already other organizations and agencies in Oceana County who carry out similar work. So what we're kind of focusing on is making those connections and really building a more, I guess, organized resources so that we're using what's already existing and who, what other organizations are already out there that are helping to address things like obesity or like access to clinical care, and really connecting those resources so that we can strengthen the positive outcome from that.
Okay, wonderful. Well, Katie, we're glad that you were able to join us today. Anything else that you'd like to add?
Just a final note that I'd like to add is that we do have a coalition, and the coalition is called Healthy Families of Oceana County, and our coalition is mainly the main group that is working on this project, and we are open to input from other community members if anyone has any questions or wants to learn a little bit more about that. We do meet each month, and I can provide you with my contact information if you'd like, if people are interested in joining the coalition or learning a little bit more about what we do.
Great. Well, thank you, Katie.
Thank you.
Yay for Katie!
Yay, Katie! Good job. Good job.
Thank you.
So Courtney, I've got a couple of items for feedback for you, Katie. Not Courtney, Katie. In the very beginning, when Courtney asked the question, tell us about the work you're doing right now. I felt you did a really good job of explaining that, but it went on for quite a while. And I think shortening that and tightening that up a little bit so that you're not losing people early on, it would be a good thing to do for the next time. So that's just some an observation for that upfront kind of background section. Okay. I really liked how you tied the fact that, you know, when Courtney's question was, is this a new approach or what's new about this is this a new project? You said, well, it is a new project, but we're building on organized resources. That's really good, and that's probably going to resonate with the audience, I would guess. So that was a great statement to make. And then at the end, when she said, do you have anything to add, with you saying, yes, you know, we have this great coalition. We'd really like to hear from you. And that was wonderful because that was kind of the call to action, what you want people to do, the steps that they should take. So very nice job. And you really spoke eloquently, but also it seemed to not be too rehearsed, which was really good as well. Okay. So that's just some of my thoughts. Courtney probably has some others as well.
Okay, thank you.
Yeah, Katie, I was going to say, along the same lines of what Lisa said, I think you did a great job in your intro, but I think one thing that you could think about doing is moving it a little bit closer to the message framework. And we kind of dove right into and I asked you the question, what are you working on? And that's what you answered, but I think you can set it up a little bit more with talking about what's going on in the community, and that really gets people hooked like that, because we can talk about what we're doing all day long, but until they know why we're doing it, they might not be as receptive to it. And you were using some really good language around, like when we started talking about the issues of obesity and diabetes, and you talked about how this will help people take control back into their lives. And I think when you can get some more of that like descriptive language, and if you use that up front, it kind of brings people in, and it's something that resonates with them and gets them on board. Because when they're hearing like, oh, it looks like we do have this issue, and then you're like, oh wait, but we have a solution, it's kind of a great arc for that. And I 100% agree with what Lisa said with the when you were talking about the making connections and building on what's already existing. I think that was a really strong answer, because and I wrote it down in my notes because I think that it would be great for a talking point too, because it shows that you're not just reinventing the wheel, you're taking what's already been learned and applying it and making it and improving upon it, which I think is great. And then just for the call to action at the end, I'm so glad you said something just in general, because I think we've done this before where we were like, oh, do you have anything else to add? And they're like, nope, I think that's about it. And you're like, wait, no, that was your time. So I think the more you practice, you can just have that key message just like ready to go, that strong point that you're going to end on, and it really including that call to action, which you talked about the coalition in the monthly meetings, but I think you could even, and this was we didn't really set any parameters, so you said I'll give you my contact information, but you could say something like, if you're interested, feel free to reach out to me. Feel free to check out our website. We'd like you to join. Any one of those like next call to action steps you could include there.
Okay.
Yeah.
Great.
But all in all, great job.
Katie, this is Cheryl. You didn't seem nervous at all. And you paused before you answered each question. You sounded very, very natural.
Yes. Yep.
Thank you.
Good. Katie, do you have any questions for us?
I don't think so. I think it is really helpful to practice just getting comfortable, with how you want to organize it and emphasizing the positive, like you mentioned, versus, bringing back to a negative fact or something. So yeah, I think just for me, it's just a matter of really practicing that helps me a lot. I can't think of any questions right now, but that was very helpful.
Great.
Okay.
Great. Well, thank you for being the first guinea pig on the line.
Yeah, thank you.
So, Courtney and Lisa, this is
All
Cheryl
right.
again. You talked specifically, at least in Katie's example, that she used one of the techniques that you described on Monday, which was hooking. Can you, for the other folks on the call, kind of go over the other, like bridging and headlining, I think it was?
Yeah, of course.
Okay.
Lisa, do you want me to take that?
Yeah, go ahead.
Okay. So the three techniques that Cheryl just mentioned, bridging, headlining, and hooking, those are all really good ways to answer, to either answer tough questions or to get back on message and share your message if things are getting a little off track. So the first one is bridging, and bridging is where you acknowledge the question that's been asked and then use a bridging phrase to move back to your key message. So you could say something like, you know what, that's a really good question, and the research shows, or you know what, I see what you're saying, but another way to look at this is use kind of phrases like that, and it's that one specifically, especially is used if maybe the interviewer asks a question that's not really the direction you wanted the interview to go. You can bring it back to your key message. So that's bridging. With headlining is using a phrase that gets people to listen up. It's an audible cue, and so things, headlining phrases that you might hear are things like, you know what, the most important thing is, or your last comment is particularly important because, and just kind of those intros to your sentence get people to listen up and know that something important is coming up next. And then hooking is a really good one, especially in a media interview, because with media interviews, oftentimes you don't have a lot of time to get your message in, and so hooking's a way to get more information into your answer than really was originally asked. So you can hook a series of related points together. So what I mean by that is if somebody asks a question, you could say something like, you know what, to answer your question, or there are three really important things to answer your question. One, and then go on with 1, 2, and then 3. And that really gets you to share a little bit more than you were originally asked, because you've got a lot of great information and you want to get it all in, but you might not have a ton of time with, especially a media interview. Okay,
thanks, Courtney.
Yeah. So I know we had, it looks like, I think we had one more person signed up for this time slot, but I don't see them on logged in.
Okay.
So I think we can open it up to the group if there's anybody who is on the line. Cheryl, I don't know how they would indicate if should they chat or can they like raise a hand or something?
Yeah, it might be easiest. There's an option to raise your hand. You'll notice it next to your name. And for anyone who's interested in doing another practice, we've got an open slot right now. So feel free to open your hand and raise your hand and I can open your line.
And Lisa, were you going to add something?
No, I was actually just going to say that we actually have a free slot from 3 to 3:30. So if you're willing to stay on for a few extra minutes, we could run through another one with somebody.
Yes.
And others of you, I know you might have to drop off, but thank you for joining.
Yeah, and even if you don't have anything prepared or want to practice, we can talk through any spokesperson opportunities you might have coming up if you have any questions or things while you're getting ready for that.
Or we can simply just go through the worksheet and help you develop an elevator speech as well.
Yeah, absolutely.
So if there's anyone who's
and we have that. Oh, go ahead.
Worksheet, feel free to raise your hand, or you can use the chat option at the bottom.
And we have that message framework and the identifying audiences worksheet right there in the handout. So if you want, you can open that up just on your screen there, and we can go through it together if you'd like.
So Courtney and Lisa, while we're waiting to see if someone is brave enough to volunteer for a practice here, let's talk about, like Katie described in detail her project, but for sub-recipients in general, how much space is there perhaps during an opportunity like a radio interview or a interview for a newspaper to mention the larger scope of the project, and would that be appropriate, or does it detract from the message about the local and community activities?
Cheryl, that's actually a really good question, because that's where knowing your audience is really going to come into play, because some audiences love that you're working on something that's part of a national program that other people are doing too, and they love that it's part of like a bigger movement or a bigger program. Others, though, I mean, on the other side of that, some people are a little bit wary of when it's part of a bigger program, or they might maybe consider it a federal program, and they don't like that idea. They just like the idea of what's going on in their community. So it really comes down to knowing what kind of messaging works best in your community, whether or not to bring up that kind of outside of your community funding. Lisa, what do you think?
Yeah, I would agree. I was going to start out by saying exactly what you did. Going back and knowing your audience and knowing what would resonate with them is really the best way to answer that question. And that's where all that work goes in up front, of before you go out to give a speech or to do an interview or whatever it might be. As a spokesperson, make sure that you have done some research on your audience that you'll be speaking with, or that the interview is directed towards, so that you can be sure that you're saying the information and giving the messages in such a way that resonates with them.
Great. Thanks, guys.
Yeah, and I think, I mean, we've seen it across the board too, with when you say something, at least for WIC, like we're working on the community partnerships for healthy mothers and children, sometimes that, I mean, it's as deep as you want to get into it for a presentation. That might be including that kind of information, and a little bit more information about the national work that's being done might be helpful, because you'll have a little bit more time. But for a media interview, it might just, I mean, time-wise, it might just be easier to talk about the current landscape and then how you're working to solve it, instead of really going into a lot of detail about the program.
Okay. So this is Cheryl, and just a reminder to folks on the call, we do have an opening at this point in today's call. So if you would be willing to practice a few questions or practice sharing information about your project, now would be a great time to volunteer with Courtney Thompson and Lisa Tensuan, both of FHI 360, part of the DCH communications team. Courtney and Lisa, how likely is it that someone would get questions in advance of their interview?
You know what, I would say it depends on the relationship that you have with the outlet. I think some outlets who are, if you have a good working relationship and if you have a relationship with them, they might give you things in advance so you can prepare your answers. I don't see that a lot. Lisa, what do you think?
Yeah, I would agree, Courtney. I don't think it doesn't happen most of the time.
Okay.
Yeah. And I think that's another thing that we've seen, and it's kind of just a learning experience as you're working with the media a little bit more. And we have our, I think we have our how-to guides, how to work or working with the media on the in the handouts pod. But I think that comes with experience, because working with the media, it's all across the board. You could have people who are working on deadlines and they need an answer like right away, and we need to talk to somebody right now. And that's tough if that's the first time you're experiencing working with someone like that, because you don't need to feel like you need to answer their questions right away. Even if you are the right person, they got in touch with the right person, you can take a moment and think about, really, is this the right interview for me or for our organization? And like take a second to step back on that, because I think it's sometimes media interviews can be a pretty fast-paced environment, but you are the one, as a spokesperson, you have the control to be able to slow things down a little bit. And maybe we could, those who are on the phone, if you want to chat, you don't have to come off mute necessarily, but if you want to talk a little bit about what audiences you're working with, if we have a lot of folks who were maybe like Katie and are working to try to reach parents with young children or caregivers with young children, or are there other audiences out there that people are working with?
So folks on the call, if you'd like, you can type that information into the chat box just to let us know what kind of audiences you're working with. So there's a chat box at the bottom. I won't call on you unless you raise your hand, but feel free to just type into the bottom chat box to let us know what type of audiences you're gearing messages towards. Okay, looks like we might have, let's see here. Okay, here's someone who's shared information. So here's Yvette Alvarez, who's also from WIC Association, and she's saying that their target audience includes pregnant women and families with kids under 5 years of age.
Okay. That's great. And so, Lisa, I was just going to say to Yvette that when you're thinking about crafting your message, just think about, really, when you're in that stage of illustrating the current landscape, that's where you can really personalize and humanize the story. And so when you talk about what's going on in your community, feel free to, you don't have to just insert statistics and say, well, and I'm absolutely making up these statistics, but you don't have to say something like, well, 50% of the families in our community don't have access to healthy food. That's a pretty startling statistic, but you can take it a step further and say, and talk about what that actually means. So that means that a family with 2 young children isn't able to, or has to go to a corner store to pick up as much food as they can, but they don't have any healthy options because the corner store only sells packaged food and sodas or things like that. That just whatever is appropriate for your audience and your audience's situation, but you can go beyond even just the statistics and share those kind of like personalized and humanized stories when you're crafting your message.
Okay, some additional information is provided. So she's also saying that approximately 50% of the population in her area is Hispanic, and their media.
Cheryl, I think you cut out there a little bit at the end.
Yeah.
Oh, I'm sorry. Okay, so Yvette has provided some additional information. She's saying that 50% of our population is Hispanic, and our media opportunity is.
Hey, Cheryl, I think your audio is cutting in and out.
Oh, okay. Hold on one moment while I make an adjustment here.
Cheryl, yeah, I think your audio might have cut out, but maybe you could share, I think if Yvette was providing additional information, you could share it in the chat potentially.
Sure. Are you able to hear me now?
There we go.
I can hear you.
Okay. All right. Sorry, guys. Okay. So I was saying that Yvette has provided some additional information. She's saying that 50% of our population are Hispanic, and our media opportunity is on Spanish television and radio.
Mm-hmm. Okay. Excellent. Okay. So I think I'm just going to pull. So Lisa shared some information on the call on, or on the webinar on Monday about some of the audience research that our team had done recently. And I'll just share, or Lisa, I don't know if you have it in front of you, but I can share some of the insights from the Hispanic audience.
Yeah, go ahead, Courtney. I don't have that pulled up.
Okay. Well, some of the things that we found with the Hispanic audience as we were doing this message testing is that they were really most enthusiastic about community efforts around healthy living compared to the other races and ethnicities that were surveyed. And they had less concerns about government spending and oversights of funds. So that's compared to Caucasians who were greatly concerned about government overreach and things like that. So that's one of those insights that kind of goes back to what Cheryl was talking about. When you talk about the national effort, it might be something that would resonate with the Hispanic audience a little bit more to talk about the national work that's being done, and it wouldn't necessarily be a turnoff for them. And Yvette, one thing that we found that I don't know if you found in your communication work too is that with the Hispanic audience, we found that cultural eating habits, a lot of people found that to be a barrier to healthy living and healthy eating. And so that was a very interesting insight. And I know I've seen a lot of programs recently that really start to address cultural eating and how to make that healthier. So you're really not losing the culture behind things when you make healthier choices. So that was, I thought that was very interesting.
Mm-hmm. And Courtney, to kind of tie that up, just to say that, one thing to consider is when you're developing your elevator speech and when you're developing your talking points related to, if you're reaching out specifically to Hispanic moms, let's say, keep all of this in mind, thinking about those messages that Elizabeth had sent out to everyone and how you might be able to tailor those a bit for the Hispanic audience that you're trying to reach out to. So just one way to go about really tailoring those messages and making them a little more, that they might resonate even more with those audiences.
So Courtney and Lisa, this is Cheryl again. Given that in your initial presentation you kind of talked about who the messengers are, so using Yvette's example where she's saying that the target population is primarily pregnant women and children under the age of 5, should she make considerations for who might actually do the interview and who might be the most appropriate person to deliver the message or to do a television or radio interview?
Absolutely. And I think, it might not be the spokesperson from the local health department. It might be that person, but then you might bring somebody else with you who can really talk about what that person perhaps might be a Hispanic mom who has a child who's 3 years old, and perhaps bringing that person along to supplement that conversation would be a way to do that. And I think also just keeping in mind that, you know, the public information officer at a health department might not always be the best person to go out and speak with whoever the audience is that you're trying to reach. So that's a very good point, Cheryl, and something that everyone should keep in mind as they're thinking about who to send out to do the interviews and the type of how that person might resonate the most with that audience. So that's a very good point.
So ideally, if folks are working in coalitions, perhaps coalition members might also be useful in trying to line up, I guess, a list of potential messengers.
Right. Absolutely.
Mm-hmm. Yeah, that's another great way to get them involved.
Yep. So I'm just wondering if there are any other questions that anyone has that they would like to type in the chat or raise your hand.
Okay, it looks like we may have a volunteer. I think Yvette may give it a try. Let me see if I can send Yvette audio information because she would actually need to call in. So I'm going to send information to Yvette and we'll see if Yvette is able to get in by telephone.
Okay, great.
Great, thank you.
Okay. In the meantime, maybe Lisa and Courtney, maybe we can talk a little bit about why the media is, or how the media can be useful in sharing messages, particularly on this initiative.
Yeah, absolutely. I think it really all, I mean, I know we've touched on this already today, but it really comes down to where your audience gets their information and who the trustworthy sources are. So the media can oftentimes be seen as a trustworthy source for information, especially if it's a local outlet or a local radio station. And so to be able to get your message shared there, so you're not only sharing your message using a trusted messenger, but you're also sharing it through a trusted source, which just can really increase the impact and resonance of your message.
Hello?
Hi.
Hi, it's Yvette.
Hi, Yvette. How are you?
I'm good.
Good. Thank you for stepping up.
Well, I don't mind at all talking about it. I'm probably not as well prepared as the previous interviewee, but you know, certainly I don't mind talking about our target, you know, my population that I'm working with. So.
Okay, great. Well, Courtney, do you want me to go ahead and start?
Yeah.
Okay. So that you were on for the entire time the last time, correct? Where we talked a little bit about, gave some background and things like that. You were on for the beginning part of the 2:30 conversation?
Yes.
Okay, I'm not going to rehash any of that then, in interest of time and to get you to the actual part where we're doing an interview. So in terms of how you'd like to spend the next few minutes, would you like to do an actual media interview, or would you like us to assist you in developing your elevator speech and talking points? And I'm assuming you want to stick with the audience of Hispanic moms with children less than 5. Is that correct?
Yes, and it doesn't necessarily have to be only Hispanic moms. I just kind of gave you that statistics so that you had an idea of our population. And our spokesperson, both myself and the spokesperson, which is a WIC clerk, are both bilingual. So, you know, I believe in the previous webinar, you mentioned the importance of that. Someone asked, I think, something about the translation, and it is, because if you don't have someone who speaks the language, then when it's translated, it doesn't come across the right way, if you're not understanding it. So,
right, absolutely. That's very, very important. Good point, and I'm glad that you remembered that from the webinar the other day. Great. Okay, so tell me just in a sentence or two what your role is with your local WIC association.
I'm the project coordinator.
Okay.
For
Okay, and which organization are you with?
With Gateway CAP, Community Action Partnership, is a WIC agency. We're also a sub-recipient of the NWA grant.
And where are you guys located?
In Camden, New Jersey.
Excellent. Okay. That's helpful for us just to know as we go through this. Okay, so would you like to focus this as a media interview or more as a development of your elevator speech, kind of what your main messages are?
Development of the elevator speech.
Okay, great. Are you at a computer? Are you able to download the message framework?
Yes, I'm looking at it now.
Excellent.
I have that available.
Okay. So we already have the target audience. For those of you on the phone, don't forget that you can, or on the webinar link, you are able to pull this document from the handout section. So that when you're thinking about the problem in your community and that moms with children less than 5, what type of fact or real life example do you have, and it can be partially made up at this point because I know we're putting you on the spot, but what type of fact or real life example do you have that might grab somebody's attention? When you go out to give a speech, let's say you have 30 seconds to introduce yourself and what you're doing at the Gateway clinic. You know, how would you catch somebody's attention about that?
No, I'm not on the spot.
We're all friends here, though.
See, I don't have that pitch, but
That's okay. Think about why it matters. You know, what's at stake? What's the consequence if nothing's done?
It increases, obesity, diabetes. I mean, that I think is a factor among a lot of the populations that we're serving, or the other callers as well, that we're trying to provide healthier options, information to pregnant moms, as well as provide healthier choices for kids. But I just wanted to say that one of the main issues that we have is a lot of families drop out of WIC after the first 2 years. And so we're trying to make it a little easier for parents to stay enrolled in WIC through the partnering with different agencies in our community that are, as the previous interviewee had mentioned, that are doing the same services, providing the same services or similar services, but having it in one location. For example, co-housing, so bringing the WIC clinic, like a satellite WIC clinic, to a healthcare provider site so that the mom who's brought the child to the pediatrician can also receive their benefits at there as well, since we'll have a satellite site. So we're trying to make it.
So I was just going to say, I think that one way you might be able to, another target audience you might have then is you would have to do some sort of sell, right, to the healthcare provider that's at that site. Is that correct?
Right. Both, yes.
Yep. So if you're trying to target, so there's two thoughts here. It sounds to me like you have two other target audiences as well. You have the target audience of those families that are dropping out after 2 years of being in the WIC program. And then a third target audience that you're really thinking about reaching over this next year might be those provider sites, the providers, or perhaps the gatekeeper at that site might be the office manager, right? Where you might have 10 minutes of time to talk with them about the situation and the problem. So as you're thinking about your messages over the next year that you're developing, or over the next few months, think about those other two target audiences. If that's a direction that you're moving in your programmatic activities, and it sounds like it is, that you're really trying to target those families that are dropping out after 2 years. And that's really good because you're even further segmenting that general population of moms with children less than 5. So that makes Courtney and I really happy as communicators and social marketers, because we say that's great, because you can even further target and target that message to reach that specific subpopulation that you're really trying to reach for the next X number of months or whatever it might be. So that was a great point that you just brought up, and I think that is also something for you to consider as you're moving into the next year and working with National WIC Association in the direction that you're trying to move. So thank you for sharing that.
You're welcome. Thank you.
So when you're thinking about, when you're thinking about that problem of, let's go back to your original audience of moms with children less than 5. The problem might be, and I think you shared this earlier as it related to Hispanic women, or Hispanic families, we can actually just generalize it right now, but 1 in 2 children under the age of 4 do not have access to healthy foods and to healthy food. So you might be able to use that as a problem that pulls in an audience that you're speaking with. So that might be one way to complete that first section of your message framework.
Okay.
And then from there, we kind of move into what is the solution. So that next section on the framework is illustrate the current landscape, why it matters, describe the solution, provide a sense of hope, and make the solution achievable. So what is the solution? What can be done about this? What do you want to tell people that you're talking to about that solution? And again, I am putting you on the spot, but go ahead and just think about that for a minute. What are some of the solutions that you're working towards? And you kind of said that just a few minutes ago. We're thinking about implementing satellite WIC clinics at healthcare provider sites to make it easier for you as a mom to access our services. It depends. If you're talking to moms, that might resonate.
We're also trying to work with corner stores to have them bring healthier options. And they may already have them in the store, but we're trying to make sure that they kind of bring them to the forefront a little bit, to put an emphasis on those healthier options as opposed to the quick grab-and-go foods that people typically migrate to.
Great. See, those are all good solutions to provide. And then thinking about what they should do. What's the call to action? What do you want them to do? So if you're talking to moms with children less than 5, what is the ask?
Well, we would like, because also, and I don't know if this sounds like it's a different problem, but for those pregnant women and families with kids under 5, there's many of them that are not on WIC and are eligible for the services. So we would like for them to call our office to set up an appointment to see how we can, find out if they qualify. And also we can refer them to other services that they may be in need of that they currently are not connected with.
Very good. And that's exactly what you could say. And you could even take it a step further and say, it's very easy to get, we're making this easy. Just give us a call so we can talk about the wonderful services that we have to offer to you, and then kind of expand from there. But that's perfect. Okay. So you just worked through a message development, and you did a great job.
Well, thank you.
So I think
great help.
Well, good. I'm glad. So just keep this framework handy. We find that it is very useful, and Courtney and I have used this a lot. So keep it handy and think about, as you think about new target audiences, as you think about those providers where you might be opening a satellite clinic, or as you think about those corner store owners that you might be working with to bring healthier food options to their corner stores, that's where you kind of work through this and think about what resonates with them, how to get their attention, what resonates with them, describing the quick solution and what can make that solution achievable, and then moving them into what that action is. So I'll let Courtney weigh in to see if she has any other thoughts on this, but I appreciate you kind of stepping up and jumping in on the fly, and I think that you're well on your way to developing those messages that are going to work with all of your audiences.
Yeah, thank you, Yvette, for sharing that. And I think what I liked as I was listening to all this is you had a really, a natural way of sharing this information, and it sounded like you would be that trusted messenger. And I liked that you were using language, even from the very beginning when you were talking about the issues that families drop out of WIC after 2 years, and you're trying to make it easier for parents to stay enrolled. Just using that kind of language, like easier and those kinds of words, you were using those before we even talked about it, and I thought that was great. So yeah, I think you did a really good job.
Thank you.
Great.
Thanks, Yvette.
Great. Well, thank you, Yvette.
So Courtney and Lisa, who's signed up for the next time slot? Do we have that person on the line?
It's Claire Sadagaza, and I don't see her signed on yet.
Okay.
I might have a little bit of time. And then we have Sandra Matthews signed up for the next slot.
Okay. Okay, so for folks who are listening, we've got Courtney Thompson and Lisa Tensuan, both from the DCH communications team. They work for FHI 360. And we're talking about how to be an effective spokesperson. This is part 2. We do have a recording and copies of the presentation, as well as handouts to share with you from Monday's presentation. Today's session is also being recorded in case folks miss it and would like to come back to it. And for anyone on the line, if you'd like to volunteer or practice perhaps working through the message framework with Lisa and Courtney, now would be a great time to step in while we are in between folks who've signed up for the practices. So while we are waiting, Lisa and Courtney, can we talk about, there was one thing that you said on the webinar on Monday that I thought was interesting, and that is that the general public is not an audience. Can we talk about that for a little bit?
Yeah, I'll start with this one, Courtney, and then you can jump in. So the reason that we say that is the general public, that is a really broad segment that's a very broad audience. And when you're thinking about message development and being a spokesperson, you want to develop those messages that speak to the audience that you're talking with. And when you're talking about the general public, there's no way that you can cover all that you need to cover for everyone that makes up that population. So we have always encouraged people to segment the general public, and think about what who you're really trying to reach and what you really want to say to that audience. So that's the reason we always say the general public is not really an audience. Courtney, I don't know if you have anything else to add to that.
I think the only thing that I would add is I think sometimes there can be a little bit of confusion sometimes when you do like when you do a media interview and you think about your audience and who you're trying to like share your message with that audience, because it does reach such a wide selection of people, the media outlets that you might be working with. But I think it's still important to keep your target audience in mind as you're developing those messages. You're never going to create a message that resonates with every single person that a media outlet maybe reaches out to. So it's okay. It's really important still to tailor that message to who you're really trying to reach.
Okay, good point. Thank you.
Mm-hmm.
Okay, for folks who are on the call, if anyone wants to volunteer to practice with Lisa and Courtney, you can either raise your hand, or if you'd like to shoot me a message in the chat box, please feel free to do that. And it looks like
So it looks like Claire's on.
Yeah.
Yep.
Hi, Claire. This is Cheryl. How are you?
Oh, hi, Cheryl. It's actually Elizabeth. I had to fill in for Claire.
Oh,
She had
okay. Hi, Elizabeth. Welcome.
Thank you.
We're doing the how to be an effective spokesperson training, and we've got Lisa Tensuan and Courtney Thompson from FHI 360 on the line. Are you ready to practice today, or?
Sure. I mean,
I know you're filling in for Claire. Claire actually had signed up, but if you'd like to.
yeah, I mean, I can. I did actually. So I participated in the first section, I guess, the webinar. I watched that,
Okay.
and Claire gave me kind of her little write-up that she had worked on based off of the template. So
okay. You guys had a chance to go through the worksheets then.
Say that again?
You had a chance to actually use the handouts.
No, I like have kind of I've like got the write-up, and I haven't actually practiced yet.
I see.
Like,
okay.
Yeah. So, sorry, this was kind of a last-minute thing. She had a bit of an emergency and was like, I'm so sorry, this is kind of a strange thing to hand off to you, but I had watched the webinar, so she's like, do you feel comfortable doing this? I was like, yeah, I love public speaking. So I was like, sure, I'll go for it.
Okay,
Oh, good. This, we're happy to have you.
Thank you. So, yeah, I mean, if you want to tell me, I don't know, you tell me what's the best thing to do here. Like, if you want to instruct me a little bit on, like, what I should do, I can try and improvise, or if you think that's not the best use of time, I can also try and reschedule another time for her.
Well, Elizabeth, I think what we could do is maybe if you want to, this is Courtney, if you want to tell us a little bit about your organization and your role, and then a little bit about where you see your role or Claire's role as a spokesperson. Is it more for things like media interviews or presentations, or really kind of informal communication, where you kind of see your role there? Maybe if we get a little background, we can figure out the best practice.
Sure. Okay. Well, so my role on the project is I'm the project manager, and our grant is kind of, I don't know if it's unique to the other grants, but basically how the structure works is that it's housed within the health department, Richmond City Health District, And I work within the chronic disease team, but we are working we also have our WIC office housed within the health department. And so partly what was unique and exciting for us about this grant was that we're combining those two departments, which surprisingly and unfortunately historically have not actually worked a lot together. And this is like a really unique opportunity for us to help the WIC, push WIC to kind of be thinking more about these larger like systemic environmental and policy changes, which is a lot of more what we do with chronic disease and long-term like health impacts. So I'm housed in chronic disease, but I ended up, and basically as like kind of managing and overseeing, is I'm doing a lot of liaising like between the departments and talking to the WIC manager, and kind of was like preparing her for this transition into a new way of thinking in this project, and then also like educating our chronic disease team about the work that WIC is doing and vice versa. So a lot of my communication has been internal up until this point when we finally have gotten staff on board, Claire, and we have another woman, Glencora, who have now are just at like the very beginning stages of implementation. And so we're like kind of more ready and preparing to do a lot more community engagement, and I guess it would be more like public speaking and outreach about the project publicly. So I think that we're kind of at a place where it's like about to shift a little bit, because we've been doing a lot of education like internally within the health department and the different WIC clinics to raise awareness and get everybody on board of this like kind of cultural shift around thinking about WIC as not just clinical services, but more of this like bigger chronic disease prevention and systemic environmental policy change work. And so that's kind of more been my role. And I think as we go forward, because Claire and Glencora are really the boots on the ground, engaging the community, doing outreach with our corner store owners at the WIC site, and also with other community partners, then they're going to be doing more of that kind of direct speaking engagements and outreach. And they're providing, like, one of the major things that they're just about to launch is a WIC 101 training for all sorts of different people in the community. Like, we're engaging a lot of congregations and churches to become advocates for WIC in their community, and then we're also engaging primary care providers, OBGYNs, all sorts of clinical practitioners around the city, so and pretty much any community partners. So they're going to be doing a lot of community engagement and promotion and outreach. And then in terms of like more of that like news media interviews, I think that will be a bit of a combination. Like, I think that there will I think I'll participate in that somewhat. But at the same time, like, Glencora and Claire are both very good speakers, and they're both incredibly passionate about the work, and they're working with it so intimately that I kind of am encouraging them to take on that role, because I think it really comes across how much they care about it, and they know it so well, and they're kind of like, living, breathing, eating, sleeping it. So have them in that role. But then the last thing I'll say is that I think I also see my role as like the manager and also the bridge between these two departments is to be having like these bigger conversations, which I've just started with our deputy director of the health department, and then with the state health department representative of WIC, of like advocating for these much larger long-term changes in terms of even like our funding streams with WIC and how we're thinking about incorporating more environmental policy and like systems change in even the roles and how we hire staff and time that we designate and fund to be thinking about these like bigger systems issues. So I think I will be probably the one kind of doing more of that advocacy and engaging like city officials or the state health department and like these larger conversations about shifting the way that we kind of operationalize this and fund it.
Okay. So what were, oh, go ahead, Lisa.
No, so in thinking about that then, Elizabeth, who would you say who would be your target, who is the target audience that, let's say, you're having the most issue with, you're having the most difficulty getting them to talk with you, or you don't seem to be able to develop any messages that kind of resonate for them? Maybe that's a direction we can take this discussion in, Courtney.
Okay. Yeah. So, gosh, well, it's still kind of early days. I haven't had anybody who, well, we've been really lucky. Basically, everyone's been very on board and engaged and excited. Actually, I think this whole grant has, revitalized WIC in a way that we never anticipated. All of the staff and internally, there's been a lot of excitement, I feel like, actually, of people feeling like that there was actually a need for a rethinking and shaping of the way that WIC was operating. So in that respect, we haven't really run into much in these conversations. The greater statewide conversation literally just got initiated this week, so I haven't had an opportunity to encounter much with that. I will say that I think what is going to be a larger challenge for us that we're anticipating experiencing, but we don't know for sure, is this bigger piece of engaging the physicians and the medical field, because we've done some preliminary surveying and interviewing of a couple pediatricians and an OBGYN. And in terms of trying to understand what would be the best way to provide them a training and to engage them, we've just heard a lot of mixed things and a lot of barriers. So I think that that's definitely going to be a group that will be challenging for us.
So, yes, I would second that, Elizabeth. We do a lot of healthcare provider research around various topic areas for a bunch of different clients, and that is a challenging group. Physicians are, because they're very busy too. Exactly. So you might want to think about, in terms of communication, if you're not able to get directly to the doctor or the PA or whoever you're trying to reach, is there a gatekeeper within that realm? So is it an office manager or one of the head nurses in the office that might be a better person to try to use as a gatekeeper to get to first, just as a thought? But I do think, it's always, it is always good to try to develop these messages so that they do resonate with those physicians, because, like I said, they're super busy. So you've got to be quick, succinct, and to the point when you're talking with them. Right. So perhaps a way to take this discussion, Courtney, I don't know what your thoughts are, but one way we could do this would be to come up with an elevator speech for the target audience of OBs and pediatricians. Or if you would rather we have about 15 minutes left, we could certainly move this in the direction of a media interview too, if you'd like to try to do that.
Sure. Sorry.
We'll leave that up to you. I know you're really being put on the spot anyway, so we'll walk you through it. But those are just two thoughts and suggestions that came to my mind. Courtney, I don't know if you have something else that might be better.
No, I was just thinking, working through the HCP, the healthcare provider audience, if we wanted to work out an elevator pitch or something along those lines. Or, Elizabeth, did you say that Claire had worked out some notes ahead of time? Did she have something in particular that she wanted to work on too?
Yeah, well, she had written she had filled out the form that's specific problem in your community, illustrate the current landscape, describe the solution, and define what individual group should do. And we had talked through it actually earlier today, because we were going back and forth even before I thought I was going to be in this role, but just she wanted some feedback. And she had told me she had just, because they're doing so many different interventions, she was like, I just tried to pick one group that we'd be talking to, which was basically targeted at the WIC 101 trainings, and her kind of pitching that to the public, saying that this is something that we're offering. But
and she was pitching. Oh, go ahead. Sorry, she was pitching that to churches, or they're planning to pitch that to churches and then also the healthcare providers, right?
Yeah, exactly. It was like faith-based organizations, private practice, or nonprofit organizations.
Okay.
Yeah. So, I mean, I don't know if we need to focus so much on that. Like, so far, I mean, they've got already about 6 different groups that have signed up for the training, and they've had people that are pretty responsive and interested. I actually am kind of curious about with like the news media and things like that, because it's something that we haven't really gotten into yet, but I think that it's going to be really important, and I'm pretty sure none of us have a lot of experience with that. So, I mean, besides like when I was doing my MPH, I took a class in communications, so I remember some basics, but that might be really valuable for us, just of like maybe, you know, important things that we should be thinking through, or like, yeah, how to make what we're working on seem relevant enough, and that, you know, and catchy enough that we're going to be able to attract, you know, like our local newspaper or whoever, or magazines would be, you know, be interested in writing about it or talking to us about it.
Yeah, I think we can absolutely do a practice. We can do a practice media interview. Do we want to, Lisa, I was thinking, we can go ahead and kind of just do a practice, and then we can talk through maybe giving some feedback, if that, Elizabeth, does that work for you?
Okay, sure.
Okay. All right. So, Lisa, do you want me to ask the questions for this one?
Go right ahead. Yep.
Okay.
I'll take
Elizabeth,
some notes here.
Okay. Elizabeth, I'll ask some questions, and kind of like take us through the message framework, but also just to get a general idea of what you're working on, like it would be if it was a media interview where people didn't have a lot of background and you were having to share that background. And I think we can just, we'll do that, and then we'll just go through some feedback afterwards, and then if you have any questions, we can go through those.
Okay.
Okay. All right. And no worries. We're a friendly news outlet. We're a super friendly news outlet.
Okay.
Yeah. Okay. So, Elizabeth, and sorry, you said Richmond County, Richmond City.
Richmond City Health District.
Richmond City Health District. Okay. All right. So, Elizabeth, thank you so much for joining us. Elizabeth's with the Richmond City Health District. And Elizabeth, why don't you tell us a little bit, what program are you working on right now?
So I'm working on this program that's called the Community Partnerships for Healthy Mothers and Children. And it's a grant that the health department received from a national WIC association. And the goal of the grant is we're doing a few different specific targeted approaches to increasing participation in our WIC program, which is a supplementary nutritional program for mothers, infants, and children.
Great. And so is this a new program that's coming in, or a new approach to working with WIC?
Yeah, good question. So WIC itself is not new. We've been I don't actually know how many years it's been, but as far as I know, it's always been a part of the health department. We run a clinic out of the physical central location in the city, and then we have 2 other clinics that we provide in different locations in the city. But what is new about it is that we're looking at different approaches to help connect more with eligible women in our community. So currently, right now, we only serve 58% of eligible pregnant women in Richmond City. And part of the goal of this grant is really to increase our outreach and education to people in the community to know that these services are available, and to serve more eligible people. So we make sure that they have better access to good nutrition education, breastfeeding education and support, and other services.
So you were saying that to get better access to good nutrition, is that a problem that we have in the community right now? Are people, do we not have, sorry, as the interviewer, you were saying better access to good nutrition. Is that something that has been an issue in our community recently?
Yeah, well, so in Richmond City specifically, we do have a pretty high rate of births of infants that are low birth weight, and that often is contributed by mothers that are getting less care during their pregnancy, and can be related to poor nutrition, and actually those low birth weights. I mean, we're at about 11.7% in Richmond as compared to national average, which is about 8%. So it is a concern, I think, in particular for Richmond. And low birth weights, often babies that are born with a low birth rate have less. They have more cognitive and developmental delays and things like that. They're more likely to have chronic disease issues as adults. So this is something that we feel like is a concern for Richmond mothers and infants.
Okay. And if people want to learn more about the project or about the work that you're doing, can they get more information somewhere?
Sure, yeah. They can go to the Richmond City Health District website, and they can look on there. We have a special page that's just about our WIC program, or they could contact myself directly, either through phone or email, and I can provide you with both of those and a link to our website.
All right, excellent, Elizabeth. And is there anything else that you'd like to add?
I would just say to keep an eye out, for the work that we're doing. We're trying to make the program more visible, so we're going to be doing a lot of outreach in the community, and next time that you're in a local grocery store, I would say to check out in the food aisles, because we're also making an effort in local corner stores to have better labeling so that people can see where there's WIC food products that are available that they can buy with their benefits package. So just to keep an eye out for those things and encourage people that you know that are pregnant moms or with new infants to look into the WIC program, because they might be eligible for some of our services.
All right. Well, thank you, Elizabeth.
Thank you.
Yay!
Yay!
Good job, Elizabeth.
Good job, Elizabeth. Nice job. You did a great job for stepping in here. How did it feel?
It felt actually pretty good. Yeah, I definitely did not feel prepared like how I would normally want to in that situation, but I really appreciate that we did that, because it was really good. It's funny. It's like, unless you practice like that, you really can't. Even if I'm by myself, I can't put myself on the spot like that to see
right.
what it feels. Yeah. So.
Well, you did a great job. A couple of things that I'll weigh in on, and then Courtney can certainly weigh in as well. I liked at the beginning when Courtney asked a little bit about your program. What is your program? What do? You did a great job of really keeping that to 2 or 3 sentences, keeping it very succinct. And that's good, because I kind of wanted to keep listening and hear what else you had to say. You didn't lose me in the beginning, so good job with that.
Okay, great.
The next question she asked was about, is this a new program or is this a new issue? And you did a really good job in saying WIC itself is not new, but I'm really not sure how long it's been around. Obviously, when you're going out to do an interview, make sure you have those facts, and I know that you were totally put on the spot today.
Yeah.
So there's no way you would know that, but do look that up, because I thought that was a really good statement. WIC itself is not new. We've been around for X number of years.
Yeah.
And now we're looking at different approaches to serve women in communities, and you did a really good job with that. So having that fact would even make that statement more, stronger. And then we went into the question of, has better nutrition been an issue in our community? You did a great job of saying yes and talking about how low birth weight is tied to more chronic disease issues as adults. One suggestion I have there is you might actually want to say what those issues are.
Okay.
You know, low birth weight shows that children over the age of 8 have increased risk of asthma or increased prevalence of asthma or whatever it might be, because that might hit a spot for somebody that you're talking with. So actually knowing those chronic disease issues might be helpful.
Okay.
And then at the end, when Courtney said, do you have anything to add? And you said, yes. Keep an eye out. Look for us in the local grocery stores. Encourage those pregnant moms to check out our service. We may have something to offer to them. That was great, because you didn't lose the opportunity of getting one more push in there about the work that you're doing.
Yeah.
So overall, I may sound like a broken record. I think you did a great job, and you sounded very natural in answering those questions, and it was very clear to me that you know what you're talking about. You know this program inside and out. So that's my 2 cents. Courtney?
Yeah, Elizabeth, I think I agree with what Lisa said about when you were talking about the low birth weight, and I'm so glad you took it to the next step and it's like, well, what does low birth weight mean? Like, what does that actually mean to have that? And I agree with her that you can even just kind of take it a little bit farther to explain what those cognitive and developmental delays could be. I think one area to watch out a little bit for where when you talk about the statistics, I would maybe rethink how you want to present the percentages, because maybe instead of saying 11.7%, you could say more than 1 in 10, or if it's 58%, you could say over half, because I think those kinds of numbers might resonate with the populations a little bit better. Percentages can sometimes be hard.
Okay.
And then I would agree that your call to action at the end was great. Like especially the next time you're in a grocery store, check out the labeling. That was such a visual and like easy call to action that, I mean, it was one of those things where I was like, oh, I'm going to do that next time I check out the grocery store. So I think things like that are really, when the call to action isn't huge, it doesn't have to be huge. It's just kind of moving people in the right direction one little step at a time. So that was a really good one.
Okay, great.
Yeah.
That was good.
Oh, I think, Elizabeth, we might be losing you on the internet connection a little bit. I think you cut out.
Oh, okay. Am I back? Can you hear me okay?
Yeah, it's a little garbled, but I think I can hear you a little bit better.
Okay.
Yeah, but
yeah. Helpful, thank you.
You're very welcome.
I can also share that I'm going to share all this with Claire too. I like that idea that with the statistics is helpful, and with giving a little bit more detail about the chronic disease. I like that idea a lot, because I think that idea of the potential for somebody to connect with the experience if it's more specific would be good. Yeah.
Yeah.
Okay. Great.
Good.
So, is there anything else? Is there anything else we're supposed to do?
No, I don't think so. So, any other questions? Anything that you have that you wanted to go over?
Not that I can think of right now, but I am wondering, are you guys available? Like, if we have something that we schedule that's coming up, would it be possible to kind of do a run through with you, or I mean, I know that there's 17 different cohorts, so I'm sure you can't be available for us all the time, but is that possible, or?
Yeah, so this is Lisa. What you can do if you have a need and a communication-related request, reach out to Elizabeth for that.
Okay.
And we have a lot of contact with her, and she can certainly link you up if need be. She's also a very skilled spokesperson, so she also would be a great resource for you.
Great. Okay. I'm thinking in the case maybe not just to vet our stuff that we know we're going to put out there, but if we do run into a situation like you were saying early on, if there's a challenging population we're just having a hard time reaching and we don't feel like our messaging is working, that maybe we could check in and say, hey guys, Do you see any like red flags here? Is there something we're missing, or that we could tweak that would make it more effective?
Yep, absolutely. Certainly, your contact is her, and she could certainly link you up with us.
That's great. Perfect.
Yep.
Thank you. Okay.
Sure.
Well, that's great. I'm glad that I kind of got thrown into this. This is good because it's now got me warmed up and I'm excited.
Excellent.
Yeah, it's meant to be. That's great.
Well, good. Well, thank you very much for volunteering, Elizabeth, and stepping in Claire's place. We really appreciate it.
Yeah, absolutely. Well, thank you for all your feedback and help.
You're welcome.
Yeah, you're very welcome.
Okay.
Take care.
Right. Okay, you too. Thank you. Bye.
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 So Cheryl, I think we have one more person signed up. Sandra Matthews is signed up for 4 o'clock.
Okay.
I think we can give her a couple minutes. I know we're a couple minutes past 4 already.
Right. Okay.
And again, if there are others on the line who would like to practice or who have any questions, just feel free to chat Cheryl, or you can chat in the box there.
So Courtney and Lisa, though, we've had a couple of folks kind of jump in who were not necessarily planning on practicing on today's call. But so far, folks have seemed to have no problems kind of openly talking about what their project is about and what their role is on their community project, and specifying what the problem is in their community. Folks seem to be jumping in pretty well and answering the questions pretty smoothly. It's good to hear folks sharing.
Yeah.
Yeah, they've done a good job.
I think the worksheets also are pretty useful in working out the specific pieces of why the problem is important, and why it matters to folks, and then kind of talking about the solution piece, which is or should be exciting for specific audiences.
Mm-hmm. I just think that worksheet is so very helpful. It just really helps people to focus and streamline those messages. We have used it. We've used it a lot of years.
Mm-hmm.
So it seems ideally you would need to complete that worksheet for each of the target audiences, right?
That's right.
Okay.
That's right. Absolutely.
Okay.
Yep.
But the good news is once you've done that, the hard part of going through for each specific audience, you do have that information at hand for future opportunities where you might be able to just simply pull out the talking points again and be able to use the same talking points or messaging for different audiences. That's great.
Yep, absolutely.
So I think we could probably give the last person who signed up maybe a few more minutes. But in the meantime, if you guys want to kind of recap or summarize, some of the things we've learned today, if we don't hear from Sandra, perhaps we can wrap up a little bit early.
Okay. Well, I guess go ahead, Courtney.
Lisa.
No, go ahead.
Okay. I was just going to say I'm really glad that we got to do these practices, and I think it was Elizabeth who said that it's one of those things where it's helpful to do these practices because even if you're kind of just practicing on like going over your messages yourself, really getting that question and answer part practice in is important because it keeps you on your toes, and when you're practicing those questions, it really gives you that confidence when you have your answer ready to go. It's kind of like right in your pocket. You've practiced it, and it's a really strong answer to share. So I like that she shared that she really enjoyed the practice. And I think it really, a lot of what we've talked about today, it comes down to really knowing your audience and tailoring your message for your audience to make sure it's something that will resonate with them. And then doing that, like Cheryl just mentioned too, you can do that, use the message framework for any one of your audiences, and it's kind of like you have a bit of a library built up as you're working on it. You can kind of pull from what you've developed depending on the kind of interview that you have or presentation.
Well said, Courtney.
Okay, I don't see our last volunteer. But Courtney and Lisa, thank you for taking the time to work with folks on today's call. Hearing a presentation on Monday and then actually getting to see it put into action was pretty exciting and pretty engaging. Thank you for summarizing some of the techniques from the webinar we had on Monday, techniques like bridging and headlining and hooking. That was the third one. And also for reiterating the importance of knowing audience and also for helping folks to kind of work through their elevator speech and some of the portions of the handouts today. So we will share handouts with the larger group for anyone who may have missed today's presentation. But Courtney and Lisa, thank you so much for your time.
You're very welcome.
You're very welcome. All right. Take care, everyone.
Okay. Goodbye, all. Thank you.
Bye.